My name is Michael Rezaee. I'm one of the urology folks over at Johns Hopkins. I am a instructor of urology here, and also a urologic oncology fellow. So I specifically deal with folks who've got cancer and tumors that involve the urinary system, which we will chat about. I'm originally from New Hampshire. Did a lot of undergraduate coursework there. Lived in Michigan for a while, where I went to medical school, and then did my residency up at Dartmouth Hitchcock, which is part of the Dartmouth Urology program. So I'm going to talk to you guys today about some things that tend to affect men as they age, and what we need to be looking for in terms of signs and symptoms of diseases and problems that affect the genitourinary system, or essentially from the kidneys all the way down through the bladder and urethra. So I'll be talking about all those types of things today. And as we get the slides going, we'll be in good shape. And it looks like Donna's already got them going here. Perfect.
Okay.
All right, great. So if you can move to the first slide, just so you can see, what I look like there. Pretty much everything I already talked about. And then we can go to the slide number 3. All right, so urology is a surgical subspecialty. So that's, a fancy word for, we're not general surgeons, but we are surgeons that specifically focus on diseases that affect, a few important structures. So as you can see in the figure on the right side of the screen, we take care of folks who have problems with their kidneys, with their kidney tubes, which are called the ureters. They go down from the kidney down to the bladder. And then we treat folks who have bladder conditions, and then conditions that affect the prostate, and then the urethra, which is essentially the pee tube where you pee out of. We also do a lot of work with people who have testicular cancer or other types of sexual dysfunction, such as erectile dysfunction. So I'd say the breadth of what we do is pretty wide, and we do treat both the medical and the surgical side. So sometimes it's with, pills or medications that we take to fix these problems. Other times people need surgery. So we kind of do it all. All right, next slide. So one of the most important things that I would like to share with you guys is that, blood in your urine is never normal. So basically, if you have an episode of where you see pink urine or red urine, or you're passing clots when you urinate, that is never a normal situation. It needs to be worked up and evaluated by a provider, especially a urologist. There are also times where your urine may look completely yellow, but there's a tiny bit of blood in it, and they can only see it under a microscope. So sometimes the primary care doctors will tell you that there's something called microscopic blood in the urine. And both these reasons, either whether you see red urine or whether your doctor tells you have blood in your urine, are some of the reasons why you may be referred to see a urologist like me. Some common causes of blood in the urine can be problems with the kidneys themselves. There could be inflammation or infection in the kidneys. There could be infection in the bladder or infection in the prostate gland. You could have a kidney stone that's up in the kidney or starting to work its way down. You could have a history of trauma. Maybe you're riding your bike and you fell on the handlebars, and all of a sudden you're having some blood in your urine. Could be a traumatic event from your urethra or up in your kidney. As men age, they can also get pretty enlarged veins around their prostate gland, which can bleed, especially if you're on a blood thinner. And the last thing that we're really most important, which is really most important, what we really spend a lot of time on, is making sure that there isn't an underlying cancer in one of those organs, whether it be your kidney or your kidney tube, your bladder, or your prostate, that may be causing some blood in your urine. So big takeaway is that blood in your urine is never normal. Next slide. If you ever do have blood in your urine, we will do special x-rays to take a look at your kidneys and your bladder and try to identify where the blood may be coming from. And then we can go to the next slide. And then we also do a procedure where we actually will look inside of your bladder to see if there's anything concerning in there that's causing the bleeding. So what you see here on this slide is this is actually a little microscopic camera that's been inserted into someone's bladder. And we actually will take a look around in the bladder, kind of do a 360-degree spin. And people are usually awake for this, and they can actually see the inside lining of their bladder. And what we're looking for are things like stones and things like tumors of the bladder. So as you can see here on this screen, this little wart-like papillary thing right here in the middle of the screen is a bladder tumor. And bladder tumors are one of the most common reasons people have blood in their urine, and they have a risk factor for having bladder cancer. So we'll talk a little bit about that. But I think the most important thing to know is that, blood in your urine is really never normal. And, we have to do some workup and evaluation to figure out where the bleeding is coming from. We can't just let it go. It may be that it's just an infection and it's treated with antibiotics, but in the event that it's something more serious, we have to do a quick procedure to figure out what's going on. So one of the things I told you is that we treat folks who have bladder problems. This is one of the bladder problems we treat. It's essentially bladder cancer, and this is a bladder tumor. And if you were ever diagnosed with these, we would help you figure out, how we take care of these, how we get them out, how we treat you, how we kind of watch you over time. All right, let's go to the next slide. So bladder cancer, and you may be able to, Donna, just hit the full screen mode. Might be easier. Should be that little presenter down in the right-hand corner, like a little easel. Next one, yeah. You may have missed it. Keep going, keep going, keep going, keep going. That one. Yep, perfect. So bladder cancer, is one of the things that can cause blood in your urine. And there are a couple of, groups of people who are at increased risk of developing bladder cancer in their lifetime. One is that we know that men are more likely to develop bladder cancer compared to women. And we also know that the risk of bladder cancer goes up over time as folks age, especially if you're above the age of 50. So if you're a male above the age of 50, there's an increased risk of developing bladder cancer. And what we know about bladder cancer is that if you have a history of exposure to tobacco products, such as smoking, that is another risk factor for causing bladder cancer. So that combination of age, being a male, and having history of smoking can put you at increased risk of having bladder cancer. Now, there's one more kind of generalized bucket, and that's kind of just exposures, environmental exposures, workplace exposures. We know that people who have, adverse or kind of increased exposure to pollution and chemicals and dyes, they're also at risk of developing bladder cancer. So I kind of say this and can kind of present this to you, not to scare you, but just to say, if you do have blood in your urine, it could be for a reason that's not concerning, but we need to figure out what's going on and make sure you don't have something in your bladder that's going to cause you a problem long term. So think about if you're, male, over 50, a history of exposures to chemical or dyes or smoking, and you really do need to see someone like me, a urologist, to figure out what's going on. All right, let's go to the next slide. So another thing that urologists do is we have a lot of our practice focused on prostate health. And all men have a prostate gland. And you can see in this figure, we've got a normal example and we've got a little bit of a different example on the right side. The prostate gland is something that kind of sits right at the base of the bladder, right, kind of like sitting right before the bladder, essentially. And your urethra travels through the prostate gland, and that's actually what you pee through. And the prostate gland itself is really meant to assist with reproduction or having children. It actually will secrete some fluid that will help the sperm get to the egg, so you could have children and be fertile. Now, the prostate gland, works well for what it's needed for, when you're young, but unfortunately can cause some problems as men age. And, one example of is the enlarged prostate gland. As you can see, the big difference between the figure on the left and the picture on the right is that the prostate is kind of a normal size on the left, and on the right side, the prostate started to grow. It's one of the only organs that will continue to kind of grow in a man's life. And sometimes it actually can grow so much that it begins to squeeze the pipe or the urethra where you have to pee, and that causes you problems. So overall, the prostate gland is something that we don't really notice or kind of think about when we're younger, but as we age, the prostate can act up in many men, and many men will get referred to go see a urologist to talk about either issues with peeing or issues with infection related to their prostate gland. All right, let's go to the next slide. So as I kind of referred to on the previous slide, one problem that we deal with a lot in urology is this kind of growth of the prostate gland over time. And when we have this growth, it's called B.P.H, or benign prostatic hyperplasia. It's a fancy phrase for just the prostate gland kind of growing and expanding over time. And that prostate gland can really squeeze your urethra. So men develop symptoms from this over time. So they may feel like they have an increased problem with emptying. You go to pee and you feel like you didn't really pee everything out, but you can't really pee anymore. It's the sensation of incomplete emptying. That's what we call it. You can also have a lot of frequency. You're peeing multiple times during the day and more than usual. And sometimes the amount you're peeing is not very much. You can also have intermittency, where you pee really good for a couple seconds, but then your urine stream kind of stops, and then it starts again, and then it stops. And that's all related to that gland being big. Other symptoms that you may have if your prostate gland's getting big and causing a problem is urgency. So you feel like you got to run to the restroom to pee. And sometimes you don't make it and you may leak a little urine, or you're really straining to urinate. So, when you get up at night or in the morning, you go to pee, it takes you a long time to get going and you really got to push to pee. And you're essentially pushing against that prostate gland, especially, that figure or picture on the right side of the screen. You're pushing against some resistance because that thing has gotten big over time. And the last thing is, if you're getting up a lot at night to pee, we call that nocturia, or peeing at night. That is another, big red flag for your prostate potentially causing a problem and getting big. So this disease, or this condition called B.P.H, is not cancer, but it's basically this enlargement of your prostate over time that can be really, problematic from your quality of life and how you live life every day. So, we deal a lot with this. All right, let's go to the next slide. So people who have a big prostate gland, they are usually sent to a urologist to kind of talk about how to treat it. And there's different ways to treat this B.P.H, or this benign enlargement of the prostate. Number one, you can take medications. Medications can help open up your prostate and allow you to pee better. And a lot of guys will take something called tamsulosin, which is basically almost like a little relaxant for the prostate to make you pee better and more easier. And that works well for a lot of folks. There's another medication called finasteride, which will actually help shrink up your prostate gland. But that can cause, some side effects, such as, feeling weak or dizziness, or just not having a lot of libido. And for guys who try medications and the medications either have side effects or they don't really work, sometimes we have to do surgery to go in and kind of get rid of this tissue. So a lot of folks who have problems with their prostate ultimately will go on to having some type of procedure to get that benign growth out of the urethra so they pee better. And classically, that's been through something called a TURP, or transurethral resection of the prostate. It's basically a rotor-rooter procedure where we go in and we kind of scrape out all this benign growth of the prostate gland and get it out of there, open up the channel, and then make sure that you can pee much better. And that works really well for a lot of guys. There's also a host of other types of surgeries you can do for the prostate, whether it's using a laser to kind of cook some of this tissue, or using pins to pin open the prostate, or even having major surgery to get rid of the entire gland. So there are a lot of options. And compared to what was available 20 years ago, there's a whole list of things you could potentially do for your prostate to get peeing better. So I would say that unless you're having problems, most guys don't need anything for their prostate. But if you're having problems peeing and it's really affecting your quality of life, that's a reason to talk to your primary care doctor and think about seeing a urologist to see if we can get you peeing better. All right, let's go to the next slide. The other thing that can be bothersome with guys as they age is prostate cancer. And that's another thing that urologists treat, especially urologists who focus on cancer. So we know that the prostate gland gets bigger over time as men age, but also, there's a risk of developing a little tumor or a little ball of cancer in the prostate gland. So as you can see on this screen, we have another kind of picture here that shows, someone's bladder and then their prostate, and then someone who's developed a little tiny, probably quarter-sized tumor in their prostate gland. Now, prostate cancer, back in the day may have, presented or may have affected people and caused like blood in their urine or pain or whatnot. But today, most of these, tumors are not necessarily found that way. We actually screen for them, or we test people, earlier on in life to make sure they're not developing prostate cancer. Because we know if we can identify these tumors early and treat them, that people do fairly well in the long term. So there are two real big things that happen with guys at the age. One, the prostate gland gets bigger, it can get problematic. And two, there's a risk of developing, a cancerous tumor in the prostate. All right, next slide. All right, so prostate cancer. I'm going to talk just a little bit about what it is, because all guys need to know a little bit about prostate cancer. Basically, you have some small little cells in your prostate gland that start to grow, and they kind of grow out of control. And your normal immune system can't stop them from growing. So they develop into this little tumor. And the problem is that this is very, very common as men age. And as you can see here, about 1 in 8 men will be diagnosed with prostate cancer during their lifetime. So if you go around the room and you count out 8 gentlemen, one of those gentlemen will have prostate cancer during their lifetime. Now, 6 cases out of 10 men are diagnosed in men who are 65 or older. So basically, this is kind of a disease of aging. It's very rare to happen in men under 40. It's more likely to happen, from age 60 and above. And it's important to know that prostate cancer is the leading cause of cancer deaths in American men, behind only lung cancer. So that is actually a pretty important statistic for everyone to know, that this is a cause of death in American men, is prostate cancer. And that's why we do so much work and try to do so much education and screening to try to identify those people who have early cancer and treat them. And then the last stat here is about 1 in 41 gentlemen will ultimately die related to prostate cancer. All right, next slide. So our biggest defense against prostate cancer is trying to identify folks who have it and identifying these tumors when they're kind of still in the prostate gland and they haven't spread out to the rest of the body. So we do a lot of work for screening folks to see if they may have prostate cancer. And the American Urological Association just this year kind of released their most updated guidelines on who should be screened for prostate cancer and, how often. Previously, based on some larger organizational data, we used to say, let's start checking folks' blood levels for PSA, at age 55 through age 70. But based on more recent data, we know that the screening needs to happen a little bit more earlier. So we screen men for prostate cancer using a blood test. It's called a PSA test, or prostate-specific antigen test. And what we're doing is we're looking for this molecule in your blood that's released by the prostate gland, and we're trying to figure out if your levels are too high. Because if your levels are too high, it may be related to harboring or having some prostate cancer in your prostate gland. The other reason it could be high is because there could be an infection in your prostate gland, or maybe your prostate gland is just really, really big and you release a lot of this molecule. But regardless, it's good to see a urologist to kind of talk about what your options are and whether you should have a biopsy of your prostate. So, based on the most recent kind of guidelines data here, we begin PSA screening at two different time points. So, for someone who's just regular Joe Schmo, doesn't have any risk factors for having prostate cancer, we usually start at age 50 and keep testing your blood every 2 to 4 years or so to see what your PSA number is. And that's for someone who doesn't have any risk factors. There's also some literature out there that says we should do this, yearly to see what your PSA is. So there is some controversy regarding PSA and how to best use it. But I think the most important point from this discussion about prostate cancer risk, and for us looking for prostate cancer, is that there are a group of guys out there who are at increased risk for having prostate cancer. And that's specifically gentlemen who have Black or African American ancestry, folks who have known chromosomes or genetic syndromes in their family that put them at risk of having cancer, and then those who have a strong family history of prostate cancers, for example, a brother or father that had prostate cancer. Now, if you are someone who has some of these risk factors, we begin looking for prostate cancer much early, even starting at age 40. We bring you in for annual blood tests to see what your PSA is, and then to figure out if you need a biopsy and treatment. The other thing that your provider may do, whether it's your urologist or your primary care doctor, is actually do a digital rectal exam, basically taking a finger, putting it into the rectum, and then feeling the back part of the prostate gland to see if there's any nodules or bumps there that could be prostate cancer. All right, next slide. So I wanted to focus on two of these risk factors in a little bit more detail. So we know that folks who have Black ancestry are at increased risk of prostate cancer and really need to be screened and get these blood tests to look for prostate cancer. And we know that because they are more likely to get prostate cancer compared to any other race or ethnicity. And they're actually, African American men are more than twice as likely to die from prostate cancer than any other type of men. We also know that African American men get prostate cancer at a younger age, so significantly younger compared to those guys in their 60s, and they typically have more advanced or aggressive disease when it's ultimately found. So not only do you get it earlier, you usually get a worse type just based on kind of your own genetics of who you are. The other aspect of this is family history. So for some men, genetic factors, that are in your DNA essentially put you at higher risk of prostate cancer. And some of these things that you inherit, from your family. So if you have, a first degree relative, father, son, brothers who have prostate cancer, that's a big risk factor for you potentially also harboring it or having it in your lifetime. Now, if you were diagnosed with prostate cancer and you were less than 55 years old, we would think about looking for some common problems in your DNA that may affect, your children moving forward. And it's also important to note that it's not just prostate cancer that is a risk factor. So maybe your father had prostate cancer and you're at increased risk, but you have to also think about other things that may be related to prostate cancer, such as breast, ovarian, or pancreatic cancer in the family, because those things can be a risk factor for you developing prostate cancer. So really it's looking back on both the mom and the dad side of things to see if you are at increased risk of having it. All right, next slide. So what happens if we do a blood test looking for prostate cancer and we find that your PSA is elevated or it's high? So, I would say most commonly you see a urologist and we order another PSA and we see if it's still high, because we know that PSA will fluctuate a little bit. And it may be that your PSA is going up over time, or maybe it's kind of sporadically going up and down. And once we see you and get to know you and figure out if you have risk factors for prostate cancer, we usually do more evaluation. We do an exam in the office. We consider getting some imaging, like an X-ray of your prostate gland, to take a look to see if there's any tumors that we see in there. And then we talk about doing a biopsy potentially. So here in the right-hand corner of your screen is one of the types of biopsies we do. We put a little needle in the prostate gland, take some tissue, and send it to the lab, and then the pathology doctor tells us whether there's cancer there. And really today, the results are no cancer or cancer. And if it's cancer, it's either the cancer that we treat or the cancer that we no longer really treat. Because we know there's a subset of men who will have prostate cancer that doesn't need to be treated. It just needs to be watched very closely over time. In the event that you did have a positive biopsy with prostate cancer, we would talk to you about whether we needed to watch it or we needed to treat it with either radiation or surgery. Next slide. Okay, so one of the last things I'll talk about is another thing that affects many men as they age, and that's issues with sexual function, specifically related to erectile dysfunction. So erectile dysfunction is another one of these things that happens to guys as they age. Some guys have a lot of problems with it, and other guys, don't have any problems with it. But a lot of it's based on your individual body and some of the risk factors that you have. So essentially, erectile dysfunction is that when you're unable to maintain an erection or get an erection to begin with. And that creates problems when it comes to having sexual intercourse with a partner because you can't maintain your erection. And there are a lot of different causes from it. Thinking about more, younger guys, there could be issues with psychological causes such as stress, pre-existing mental health conditions. You may be on medications that prevent you from having good erections. But for a lot of guys as they age, it's not even related to the psychology of it. It's related to just physical things related to your body. So you may have diabetes or high blood pressure or high cholesterol or heart disease, all things that affect your erections and make them worse and prevents you from having intercourse the way you once did. Also, if you've had surgeries on your prostate glands, such as taking it out for prostate cancer, you can have problems with erections. We also know that folks who have a high use of tobacco products, alcohol, drugs, that can affect erections. And sometimes just trauma. Somebody, fell off their bike or had a pelvic injury or fracture, and that can cause issues with your erections too. So this is something that we see a lot of guys for. And if you're having problems with erections, it's worth talking to your provider about to see if you'd be interested in doing something about it, knowing kind of what's, your best wishes for you and your partner. All right, next slide. So there are a lot of different treatments for folks who have erectile dysfunction. One of them is just kind of lifestyle things. You focus on losing weight, getting healthier, working out, eating better, and that can improve erections. But there's also, situations where you may need to trial a medication, such as a medication called sildenafil or Viagra. There's also options for injections where you can actually inject medication into your penis to get an erection. And then for some guys, especially if you've had big surgeries in the past, you may consider a prosthesis. And that's kind of like getting an on-demand erection here, where you can actually have this system put inside of you. And whenever you want to have intercourse, you actually pump up a little balloon and you get an erection. And this is actually the most successful option that we have. Men and their partners are very satisfied with having a prosthesis place, 85, 90% of the time. All right, next slide. So the last thing I'll talk about, and I think this is heard on the radio and probably some commercials on TV, is this thing called Peyronie's disease. And it's basically you getting a curvature to your penis over time as you age. And basically what happens is you get some scar tissue or some plaque on one side of the penis, and the penis kind of curves towards that side. The problem with Peyronie's disease is it's not usually painful, but it can affect your erections, because if everything's getting bent over, your penis is not getting full of blood when you have intercourse, and over time, the Peyronie's disease makes the erectile dysfunction worse, and the erectile dysfunction can make the Peyronie's disease worse. So it's kind of this vicious cycle. But there are treatments for Peyronie's disease. So if you notice an abnormal curvature to your penis, there's actually injections you can get from a urologist to try to break up the scar tissue. There are surgeries that can be done to try to fix this thing, especially if this is causing a lot of distress or discomfort. This is something that you can also see a urologist about. Overall, it's not going to hurt you. So if you're not unhappy with the way things are, you don't necessarily need to see anyone or do anything, but just keep in mind that, we are here to try to help you through some of these things and just get more information when you need it and when you want it. So those are kind of the slides that I had, just kind of a brief overview of kind of, men's health, what we kind of think about, as men age and why you may want to see a urologist. And I would just ask if there are any questions from anyone, and happy to answer them or to go more detail on anything.
Al's raising his hand.
Yes.
Hi, Dr. Rezaee. Thank you very much for a very straightforward and very complete and very understandable presentation. A couple of questions. Split stream, is that another effect of B.P.H?
A split stream?
Stream in your urine, yes.
Yeah. So you're talking about kind of when your urine goes like this or goes up and down?
Yes.
Yeah. A split stream is not necessarily related to your prostate gland because the urine's already kind of made it past the prostate.
Bladder.
Yeah, and it's in your urethra. And usually a split stream is related to, you could have a little stricture or a little an area of narrowing at the tip of your penis, or there could even be a little web of tissue there that needs to be broken up to get you to pee, straight and in one kind of tube. So if you're kind of peeing in multiple directions, you may have a little bit of scar tissue there that could be broken up by your urologist.
Is that what an endoscopy would be for?
That's what a cystoscopy would be.
Cystoscopy.
Yeah, we would take a look and put a little scope into your penis, into your bladder, and try to figure out why you were peeing that way. If it was bothering you, if it's not bothering you, then we don't necessarily need to do anything. But if it is bothering you and it's kind of a quality of life thing where you're spraying everywhere, then it's worth taking a look.
Can constipation be a result of a bladder problem? Although I know it's colon related, but can it contribute to constipation?
So usually things go hand in hand. So someone who's constipated is going to have more problems with emptying their bladder. There's only so much space in your pelvis. So if you've got a lot of stool and a lot of urine, it's going to be hard for you to empty out either one. So usually we kind of focus on people working on their bowels, getting them nice and soft, and then try to get them peeing better. And if they're still not peeing the way they want, then, you come see the urologist and you figure out what's going on.
The other thing is about getting up, the nocturia you talked about.
Yeah.
I'm a regular almost at 4 o'clock. I could set my watch to that. And that's not my normal entire, circadian cycle, if you will. So that's got me a little confused. Why is it's almost regular at a certain time and never more than that. It's only once. Then, of course, it's hard to get back to sleep again.
Yeah, I think it probably is a couple of things. One is, when you put your legs up at night, some of the fluid that's in your legs goes back to your kidneys. And as that happens during the nighttime, it kind of happens at a similar rate. And you probably have your sleep cycle around, you're the lightest amount of sleep at 4 a.m. That's when you have a sensation in your bladder. So that's just kind of like clockwork that, you are more aware at that certain time. And your bladder's full because all the fluid's going to your kidneys and your bladder's filling up. So I think that's probably what's going on.
I have a question from Bob. Any comment, and I'm probably not pronouncing it right, aquablation?
Yeah, aquablation. So there are a lot of, that's a procedure to treat B.P.H or problems with an enlarged prostate gland. Aquablation is an option for guys to use to basically ablate or remove prostate tissue. So that's something that is offered at different practices, and I don't think it's offered here at Hopkins yet, but I think they're interested in getting that going. But there are other groups in the community that do aquablation. But essentially, it's a procedure where you're using, high intensity water, and you're ablating the prostatic tissue, and you're essentially getting rid of all this kind of mass effect in the prostate gland. And then the urologist goes in afterwards and does a little cauterizing to make sure all the the bleeding is kind of resolved from the procedure. But it's another, approved treatment for BPH, and I think it's a relatively good one.
Another question.
Yeah.
I'm 84, and so I'm attending this to get information because I have to get to a urologist. And that age is always for people that age, myself. You're weighing, should I be doing something or not, given how old I am? So is that a gamble or not a gamble comes up based on the diagnosis? Like, if somebody determined cancer, should I get that cancer out of there?
Yeah.
At age 84.
Yeah. I think a lot of it has to do with, how healthy you are and kind of what your goals are. If someone doesn't have a good 10 years of life expectancy ahead of them, then, looking for prostate cancer, is probably not the best thing to do. But if you're relatively healthy and you're very concerned about it, then, it's worth thinking about. But we stopped screening guys at age 70 for prostate cancer because the chances of you dying from something else are actually way higher than dying from prostate cancer, whether it's a heart attack or a lung problem.
That's why I brought it up. Okay, thank you. There's a very good answer. I appreciate it.
Yeah.
Any other questions from the people attending? You can unmute yourself, raise your hand, or put it in the chat. I'm not seeing any other questions, so I thank you very much.
You're very welcome.
Sure, no more questions? Okay. Well, then I thank you, and I appreciate everyone attending.
All right, thank you all. Everyone have a great day.
Thank you, Dr. Rezaee.
You're welcome. Bye-bye now.
Bye.